Hi, it's Dr. William. I just want to share with you this story here with this patient. She's 1 month out from a tummy tuck and liposuction, Lipo 360. And I always get a lot of questions when we talk about lipo of the back about what will happen with the back rolls.
Behind the mask. The more you know, the better you look. Behind the mask.
I'm always a little bit kind of wishy-washy when I explain to people because we need skin in the back in order to move. And therefore there's excess skin, there's always going to be some skin here for just arm movement. And then when people gain weight, they develop this excess skin, and I never know how much of that excess skin is going to redrape and flatten after surgery. So here's an example where she really had very good redraping of her skin. You can really tell she has really beautiful skin, has a really good quality skin. She's still wearing a board in her back. She's only a month out, so I usually like people to stop wearing their boards, but it's always difficult to get people to stop wearing their boards. So that's where you get the impression from, and that just indicates she's still swelling. So she's probably going to go down about 5 or 7% still in terms of swelling. But if you look at her before photo of her rolls, you'll notice there's a huge difference in terms of how these have settled down. So both of us are super happy, and I don't like to promise patients that the rolls will go away, but frequently we do see them with a significant improvement. But I don't like to advertise that or tell a patient that, and then she doesn't get that result, and then she's not as happy. But this is probably what I see more often than not, is that people really get fairly flat in her back. You can see she's got a little fullness here. And it's not perfectly flat, but if you compare it to the before photos, it's a significant difference. And so one thing you'll notice is that she does have some fat in her arms, and we purposely did not lipo them at the time of her Lipo 360 and her tummy tuck. I don't like to do arms when I do a tummy tuck because I think it limits the mobility of the patient. In other words, it inhibits their recovery. And tummy tuck and lipo is a big operation, and I want people up moving around, and I don't want to take away their arms because of pain, so they can't do that. So in a month or two, whenever she's feeling well enough, then we'll go back and we'll just do just a simple arm liposuction, just to get everything to match a little bit better than they are right now. So that's in the works. I'm just going to show you her tummy. And so here she is with her tummy. I just took the tape off. Which is why she's got sort of some of this dry skin here, but the scar is actually going to look very nice. There's a little area here where you see a little stitch poking out, and it's a little red. This will probably open up a little bit. The stitch will fall off, or I may remove it in a week. We'll see, and then that'll heal over fine. And her belly button, she's got a little crusting over here, but that's healing in pretty nicely too. She's nice and flat, and her skin is nice and soft. And so that's really what we're looking for. And in terms of the scar care at this point, what I've advised her to do, because she's 3 weeks out, or a month out, is to start using the roller and apply the scar gel along the incision, rubbing in little circles and then in a line. Do that for the whole length of the scar. And then also wear the scar strip at night, which is that silicone gel. And wear that little silicone gel strip at night, and do all of that for 1 year.